appreciate that. Welcome to 2022 and Happy New Year, everyone. Like I said, if you can turn on your camera, that would be great. We never go over Zoom etiquette, but camera, great. If you can mute when you're not talking, please mute. If you have, noises in the background and that, we understand that. We recognize that everyone is in a different place. I have kids when I'm at home and people get to hear them scream all the time. So that is okay. Don't feel embarrassed or concerned if there's noises in the background. That is just part of life. And I don't believe we're going around to do introductions today unless we feel we have time at the end. So please put your name, your organization in the chat, and just let us know who's here and let others know who is here as well. I want to also thank, I know especially some of our partners who are dealing with the COVID Omicron surge. Thank you all for being here. I know that you have a lot of things going on your plate. So the fact that you are ensuring that this is a priority for you, we appreciate that you recognize that as a priority, especially focusing on long-term things while we're dealing with some of the urgent needs. And B, we're excited to have you aboard on this. We also want to recognize this is a new meeting format today. So normally for North Central Accountable Community Health, we have work groups and we send meeting requests out to those work groups. They put it on their calendar based on those meeting requests. In 2022, we're really moving more to a format with partner convenings, with topic convenings where we're going to invite all to engage. So instead of, in a way, having a select group of work group members join, it's really going to be open to the public to participate in this work. The positive and downside to that is continuing in 2022, we will send out meeting information, but we're going to ask you guys to then click on that information to embed it in your calendar, whether it's Outlook, Google, Hotmail, whatever some of those still systems are out there. So please keep that in mind. Please share that with individuals you think should be at these meetings. We'll continue to work with people to get that habit going, but we also recognize, and we recognize for ourselves, that is new, and we all live in a world where we are used to just clicking that accept meeting button 3 months prior and just putting it on our calendar and not worrying about thinking about it until then. I also want to introduce, as we start 2022, NCACH has, we actually have one new team member that I should actually introduce, and then I'm going to introduce our consultant. So David Gain, our communications manager, joined us at the end of the year. So he is probably a new face to a lot of people as we finish the year and getting started out on this new year. I want to also introduce, there really are our team members, but they're going to be assisting us in today's discussion through 2022. Our community initiative organization partners, Elizabeth Hartag and Monty. And Monty, I am not going to get your last name right now that I think about it. How do you pronounce it?
Anywhere close. It's Roulier, but if you have, I will not be offended however you pronounce it. It's nice to join you all.
Monte Roulier. So I'll put a link to community initiatives in the chat, or Caroline, can you dump a link in the chat? They're an amazing organization. To be honest, by luck, we came across them because another one of our ACH partners, North Sound Accountable Community Health, has been working with them, as well as one of our other contractors, Chris Kelleher. And so we got introduced at the middle to the end of last year with Monte and Elizabeth, and they have just been a vital component of the work we're doing as we're focusing on 2022 and beyond. And like I said, they're an extension of our team in that regards. They're an extension of everyone in the region. You can tell that they have just as much passion and care to make improvements in North Central as any one of us do. Other than that, again, I just want to say thank you all. Again, you're going to hear a lot about our vision for 2022, what we're trying to build from here on beyond, and really our goal of moving beyond what we've always been as a Medicaid transformation project organization to really an organization developed to support the needs of our region. I'll save some of that for later, and then I am going to pass it on actually to Monty or Elizabeth to set the stage for today, or actually Caroline.
Ian, Joey, we wanted to share a couple of reflections and quotes. As we're thinking about this year, we've been drawing a lot of inspiration from leaders across the nation, and then also leaders in books. And I actually had the pleasure of doing a Dare to Lead training, the Brene Brown training, and I really appreciate her quotes around how to be a leader, which is not necessarily, you know, anybody at the top. It's about somebody who sees an opportunity and grabs it and steps forward to work with others. So I'll share the first quote because I think we're really seeing 2022 as a year of connection for the ACH and increasing community engagement. So Brene Brown says, connection is the energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, and when they derive sustenance and strength from the relationship. And hopefully we can really live into this all year, and you can hold us accountable to it and also join us in trying to be in community in this way. And Joey, I think you were going to share the other quote.
Yeah, the second one is really fitting for a lot of the work that we all do, and I think it's a really good quote. It's by James Baldwin, and he says, "The place in which I'll fit will not exist until I make it." Really good.
So next slide. And Monty, I think you're up.
Great. Thanks, Caroline, and thanks, John, for kicking us off. And Joey, yeah, Elizabeth and I, you know, who represent the community initiatives team here, are really grateful to be joining you on this journey, and appreciate you all taking the time here at the beginning of the year to really, in some ways, step back. And so, as John suggested, we'll be helping, including with our Better Focus colleague, Chris Keller, over the course of the year, really with strategy and capacity building. And today we're here really to serve you all as facilitators to kind of maximize your time together. And this is, you know, like a lot of meetings at the beginning of the year, a chance to kind of step back and kind of take a broader view of what the year looks like, and in the spirit of co-creating that year. So you're going to hear a little bit of what that looks like from a couple different voices, and we're going to have a chance in some both smaller group and larger group formats to actually have you all as partners that are creating, that are building this year as you're making some of the transitions. And I think John's going to remind us of what that starts to look like. But again, we're going to all have a chance to kind of shape that together. And I think towards the end of the meeting, just even thinking about some really practical pieces that relate to funding and activities that we'll have a chance to kind of touch on before we part together. So that's our high level agenda, focusing really on the big picture of what this bridge year transition looks like, a chance for us to kind of better understand that, shape that together, and kind of land on some pretty practical points to make sure that folks' questions get answered for what this looks like and what is known. And there may be some things that aren't known at this point. And so Elizabeth and I just wanted to offer up, you know, as facilitators, some working agreements. And as John suggested, there's some early birds here. So some of you got started before being on time, but just appreciate everybody being here. And we will, you know, honor your time by making sure we end on time, if not a little bit before. Because we're going to be in, you know, small and large group formats, we're asking that everybody just share airtime, make sure that some of us are more extroverted and introverted, and that, you know, you all just kind of create space and speak into the spaces, and use the chat to the extent that you're comfortable. This is absolutely the place to test some new ideas. And we like to say, sometimes we have this a little bit backwards in our culture today, to really be rigorous on ideas. You know, what is going to make this work together as we're moving into this term distributed leadership has come up recently, I think, in this network. What does it mean to really share and distribute leadership? And so to be rigorous on ideas is important, in general on people. And we like to think a lot about how we learn and act together through this idea of dialogue, and dialogue is used in a number of different ways. We have a next slide that kind of defines that a little bit more, that's consistent with these working agreements. And so the spirit of dialogue, and I've shared with some of the board members last week, I'm more of a debater. So that's my natural default. And I've learned to really appreciate and try to practice dialogue in my work. And it's gone a long ways in kind of partnership work. Some of you are probably more natural at it than I am, but debate is assuming there's one right answer. It tends to be combative. It's usually about winning versus assuming that there's not just one right answer. And that's why we need partners. That's why we need all these different puzzle pieces. And it is about discovering common ground and exploring common ground. And when we're in the debate mode on the left-hand column, I find myself kind of listening for potential weaknesses or flaws in what might be shared or somebody else might bring to the table, versus really listening where there's opportunities for agreement and to build on something. It's really not defending assumptions, but revealing those, as you can kind of see on this graphic. And I think one of the interesting things about dialogue is it's really balancing, kind of bringing your experience into this conversation, and not just this meeting, but over the course as this partnership continues to evolve. So what is it that you know through your lived experience, the values that you bring, and where can you remain curious and open? And, when we're in dialogue, it's the art of thinking together. There's a sign on a little church in North Carolina that our team had seen many, many years ago that says, "Come as you are, but don't leave as you come." And I know that we're in dialogue when we're willing to be transformed, when we're willing to be changed by kind of what we see and experience. And we hope this meeting in a small way will be in the spirit of dialogue, and just encourage you and invite you into a dialogue here. Next slide. So again, there's been lots of changes afoot with North Central ACH, and we're going to jump into a little bit of conversation with some different perspectives from partners and leaders. But before we do that, I think, John, you're going to help anchor us and kind of do a little bit of a level set around kind of what the knowns are and what that shift starts to look like. And then we'll breathe a little meaning into that through a panel. So I'll pass it back to you, John.
Yeah, so to get here today and our focus for 2022, this journey really started a while back ago. And one of the major steps that we made in changing how we do business and how we see ourselves as an organization was in 2020, when we adapted a new mission statement for the organization. So I'm not going to read the mission statement out loud, but you can see on the screen, if you have access to the screen, on the left, you can see the original mission statement that was formed in about 2017, when North Central Campbell Community of Health was really established to support the work on a contract with the Washington State Healthcare Authority around the Medicaid transformation project. And on the right, in 2020, you can see the new mission statement that we adapted as an organization. So the things I would call out when you are reading through these is, when you look at what we were originally formed as, we were really formed as an agency to support healthcare and healthcare improvement, reduce healthcare costs, and improve quality of care. And that primary driver was really through the means of implementing projects that were given to us through the Washington State Healthcare Authority. So a project-driven healthcare-centric organization. And that was very applicable when we were formed, and we thought that our primary goal and our only goal was going to be that Medicaid transformation project. But then when you go to the right and you see really how we've changed, is our organization is really expanding what we mean about health, and we're really looking at health and well-being, especially whole person health and health equity. We're really trying to change the way that we think of being a project focused agency to one who really comes together to support collaboration and bringing partners together to come up with the right steps to drive system change in our region. So instead of having identified needs given to us that we then filter down to everyone in the form of a project, we're really, the mission's really called out that we bring everyone together to identify those needs and how we're going to change that system. And our goal is getting people and convening people to do that. Can you go to the next slide? So that really was called out, and the next step really to support that mission was in July of 2021, our board approved what we call the 3 pillars of NCACH. So these pillars were really formed to add kind of that next phase in how we're going to drive and support our mission, how we as an agency really are going to be living our mission in the future. So in combination with the mission statement, these 3 pillars are really designed around how we're going to organize to meet the needs of our community and how our community is going to identify our future work. I'll read through these quickly because you will see these a lot over the course of this next year. You'll see the mission statement too, but you'll see these a lot too. So 1, build through an inclusive process of distributed leadership, anchor and shared measurement, and advanced transformation with the regional portfolio. And I will say these pillars, especially the first one, has inspired a lot of our journey over the last 3 months, specifically looking at how we do distributed leadership, cross-sector alignment, community engagement, and network leadership and building. And some of you attend our board meetings, some of us do not, but we've actually, with our governing board as well, has been really focused on that specific #1 bullet about building a process of inclusive distributed leadership and how we as a region are moving from a governing board who makes decisions to one who again helps facilitate the process so we share decision making and share power across all our partners. So even though we're going to go through some priorities today, this in itself is one of the priorities, is how we're going to be engaging partners to focus more on collaboration this year, and how the work and decisions get made, whether it be funding, whether it be the needs of our region get identified through that collaboration and through those conversations with partners versus necessarily identifying them and then engaging partners into this work. And that ultimately today, you know, when we talked about how we were gonna present this today, one of our focal points was to stop for a moment and emphasize this, because what we want everyone to know is this year is really gonna be a process and a collaboration with all of you. And so all of your guys' input is just as valuable on how we shape this work. And we hope to hear from you and hear those needs versus you guys waiting to hear from us on some of that stuff, on the needs of the region. When you go to the next slide, that does bring us to some of our 2022 goals and objectives. So in 2021, we did get together as an agency and we went through an internal strategic planning process to identify some key goals for what we're really calling a bridge year for this year. So we actually were assuming at the end of last year, we were going to finish the Medicaid transformation project and then have a bridge year while we kind of figure out and determine our future state. So when we identified the goals for this year, what we did recognize is that it did include learning from our community partners on what the needs are and where we want to go from there. We also recognize as we build out our goals for 2023 and beyond, that we are still going to really emphasize a process of shared decision making in those goals. And so we recognize what we have set for this year meets a lot of the needs of our community, but we want to go beyond in the future and even make it more distributed in how those decisions and those goals are set for 2023. A few things I want to call out on these priorities and these focuses for this year is one, and just kind of if you kind of follow from left to right, one, we're going to have a focus as an organization on health equity and focusing on health and well-being as a whole versus just healthcare. Two, we are going to be working with partners and we really want to emphasize cross-sector collaboration and alignment. So really how our partners and community members working together, whether it's, you know, even within sectors, but especially across sectors to improve care versus just working in our own organizations and in our silos. We recognize, if you go over to number 3, that behavioral health is still a need of our region. And I think if, you know, even though we didn't do as much of a process in gathering community input, if you talk to most community members, you will find that behavioral health is still a huge need, and we will be working on that over the course of this year. And that will be a focus. We also know to build distributed leadership as you move to number 4, that includes lifting the voices of all individuals. And so as part of the process and helping support distributed leadership, we're going to be supporting grassroots partners and how that they can advocate for their work locally, and then how we as a region can locally advocate up to the state. And then 5, we really understand that partners still need to build capacity to do this work. And so we're going to be supporting partners to build capacity over the course of 2020 to move this work along. You can see these are 5 key set objectives we have this year, or goals. And we also have objectives underneath them that outline some of the key next steps we'll do that we'll actually share outside of this meeting with the meeting recording, some of those additional details. So when you think of what we're going to be doing this next year, you can see kind of those primary objectives for 2022, while when you see the 3 pillars, building our organization to be set up to continue to identify objectives and priorities for 2023 and beyond. The last thing I want to mention as well as we go out throughout this year is we're going to continue to be sharing this information and bringing people together to learn where your guys' priorities are, to learn how we can better support these priorities and future priorities. But I just want to also just put out that offer to everyone on this call that, you know, if you guys have any questions or ever want to sit down and talk about where you see the needs of the region are, or other individuals our agency should be connecting with, I really want to encourage you guys to directly reach out to us anytime, whether it's a one-on-one conversation, whether you're bringing a group of people together to have that conversation. We're really trying this next year to move from, you know, NCACH, us mentality supporting you guys to this is really our region. So anything we can do together to move the needs of the region is important. And we rely heavily just as much on you guys as you guys rely on us. So I just want to leave that as an encouragement as we move into the discussions for today, that as we talk about this, we think about us moving together as a region and not just what NCACH can do for you. And that, with that, I'm going to turn that over to Monty or Elizabeth for the piano.
Thanks, John. Yeah, appreciate that. And yeah, we thought we would just maybe hear a couple of other perspectives from the board and a couple of the CHI leaders around how this both is sitting with them and how they're thinking about this, just so we can hear this in some slightly different voices. So we have on our screen somewhere there, we have Molly Morris, who I think many of you know, who is the board chair, as well as Michelle Sandoval, who's one of the CHI leaders from Okanagan. And then we also have Rochelle Lang, who's from Grant County. And so the 3 of them, welcome, are gonna just kind of be here for about 15-ish minutes or 20 minutes. We'll just have a little bit of an informal conversation. And so wondering if each of you could take a turn. Maybe I'll start with you, Molly, and just do a brief introduction of who you are, and maybe even one of the values that's really important to you that you kind of bring to this conversation and the work that you do with North Central.
Okay, thank you. Yeah, and I'm the board chair, and it is my pleasure to get all of you together today. I'm so excited about this next phase that we have going forward. By the work experience that I have, I'm more of a community health worker, care coordinator, actually working with individuals to better their life with social determinants of health, primarily. I'm so excited about this bridge year. It gives us an opportunity to take a breath, look at the landscape, and see what we have to work with. That's sort of my goal this year. I just want to see what's there, analyze it, and then making plans going forward for the new NCACH. So, Michelle?
Sorry, go ahead, Michelle.
Sure. So my name is Michelle Sandoval. Hello, everybody. So I am here today both as the Okanagan Coalition for Health Improvement co-lead, but also as a co-executive director for Fire Youth Center. who is also an NCACH partner. So thank you all for coming, and I'm excited to hear your thoughts.
And Rochelle.
Hello, I am Rochelle Lang, and I am the Grant County CHI lead, as Monty had introduced earlier. I am also the Director of Business Retention and Expansion for the Grant County Economic Development Council. So yeah, I'm excited here to hear what folks have to say and be a part of the conversation.
Yeah. So maybe we'll keep this informal. You all can jump in at different points, but just as you're hearing John describe this shift, this bridge year, what do you think is particularly significant? What does it really imply for partners or the board? And, for those of you that might be associated with the CHIs, what jumps out for you that is really most significant or holds the most meaning for you?
I think I sort of gone into that a little bit, but I really want to see what is out there. Who are our partners? Who rises to the top? A lot of the information that we need is the data. So looking to see what you all are gathering as far as data so that we can blend that to get a true picture of our whole community as North Central. And then seeing what your needs are. We have needs assessments that we do. So looking forward to seeing all of those and getting a true picture then of North Central.
Mm-hmm. What about you, Michelle and Rochelle?
I think the most significant change for me is not, it's a minor change in intention, I think, but a major change to make it a change of mission, and also in the way that the NCACH is coming and reshaping objectives and goals around whole person health. And so to me, when I hear us making those meaningful changes in our region, I know it takes time. I know it's more than changing a definition or a mission, but it is significant to me because I know we are all coming forward with these new definitions and a new passion for this value to find what is whole person health and how are we going to get there together.
Rochelle?
Yeah, I think, both Molly and Rochelle said it very, very well. And just how that shift, it's kind of a shift of mindset and just perspective of how to go about different things. And so I'm excited for the collaboration. Molly touched on it. I love data and being able to really tell our story and tell it well. And I think you get that with that substance. And so if we can come together to be able to do that and lean on one another, I think that is so incredibly valuable to bringing things to our region and whatnot. And that's, maybe only just a sliver of it, right? In the grand scheme of things. I think Michelle touched on more of that overarching perspective of kind of that shift. So yeah, that's kind of where I'm at.
Yeah, I hear John talking about, in some ways you all inherited a really clear plan. It was more of a top-down naturally with community transformation grant, and now in this bridge year, you all have a pretty open canvas. In some ways, not entirely. There's some ideas, but it's trying to figure out exactly what it is that you all, as a region, want to be doing, and that's a pretty significant shift from kind of the type of reporting and expectations. So just wondering how that feels to you. And I'm also just curious about this term well-being. Michelle, you talked about whole person care. When you talk about a shift from health and to really well-being, if that holds any significance, or, there's a lot of different definitions of well-being, wondering kind of what stands out for you when you think about individual and collective well-being.
And was that for anyone to answer?
Yeah, that's for any of you.
Oh,
Yeah.
okay. Because I just want to acknowledge that we are 3/4 of the way maybe through a pandemic, And how has that affected us? How has that affected the individuals and their social determinant needs? So this is a moment in time that needs to happen, and how timely that we're going through this shift and this power change at this moment. And let's take advantage of that and let it rise to the top. So.
Mhm.
I think for me, I think as somebody who kind of works, with the coalition, but also, I am very involved in our direct services that we provide for the community. I think it is so clear when you're in the work that health and well-being is more than healthcare. And it is astonishing, like, oh, we're just, like this just happened in the last 15 years, that we're trying to make this shift. But it is just so clear that your health and your well-being are more than just hospital visits, and are more than just well child visits, or any of those things related to healthcare specifically. And so for me, when I think about well-being, and when I think about whole person health, and what I get excited about as we're entering into these conversations, is that we are including housing, we're including mental health, we're including substance use, and we're not just including those things when it comes to treatment or diagnosis. We're talking about them through the continuum of care, right? We're talking about substance use, not just for people who want to seek treatment, or not just for people who, want to get into residential treatment. We're talking about people who are currently struggling with active use. And we're talking about, what does it mean for everybody to have a right to housing? And so when I think about well-being, I think about it is broad things that impact your health and your happiness, and your ability to maintain stability in your life. And it includes community, how we work on this, and the elements that and attitudes that we have as a community, because those are such important parts, and stigma, and our ability to wrap our heads around these factors are such an important element to really changing health.
Rochelle, did you have anything you want to add?
I think the biggest thing with this shift, because we see it at our child level, for just within Grant County, about having, multiple groups, some coalitions, some forums. They're all kind of called something a little bit differently, and we're all going after kind of that individual thing, individual agenda. And if you look at it as a whole, we're probably all trying to accomplish a similar agenda. And so I think what's really important in this conversation with the NCACH is just ensuring that they are kind of that, like you've said, that bridge, because this shift is huge and pretty monumental. And ensuring that we are making sure everybody is kind of able to come together and keep that in perspective, and that we need to make sure that everybody is at the table to make those changes effectively. I think that's really important, because it's a different way of thinking. We talked about it a little bit last week, about kind of leaving those agendas at the door. And so that's where at least for me, is just really looking to the NCACH to be that person, or that organization that just helps kind of with that shift, but keeps us on track because I think it's, that it's going to be a hurdle to get other folks to kind of understand that. It's incredible, and it's I think the route we should be going, right, as that whole person health, and how you can't just pin it on one particular thing. But I definitely am looking for, from a CHI standpoint, but then just too in the community and North Central Washington, just being that leader to really steer this, because I'll be honest, I haven't really seen it in the past, and I think it could be incredible. Yeah.
Yeah, thank you, all of you. And Penny, I see your hand raised, so I'll come back to you. And I just want to, not very long from now, we're going to jump into smaller groups and let you all kind of weigh in on this. So just thinking again, as I'm hearing, not just, whole person healthcare, but as a region, what does coordination and collaboration look like at a whole different, deeper level? And perhaps some of the challenges that we've experienced as a community over the last couple of years gives even more significance to why we need to be thinking differently, more broadly about mental health and access to housing. And Michelle, I heard a little bit in your comment, that well-being is really about building the capacity for people in equitable ways to kind of live their best possible lives. So this is, how do we make sure that we're meeting people's needs, but really setting everybody up? Are there any other pieces, you started this, Molly, that particularly in the last, year and a half, 2 years, through this pandemic and through the economic decline and maybe awareness of greater inequities in all of our communities across the country, are there any things that brings up for you that you think has significance for what the ACH might be thinking about or how it would do its business differently?
Well, I know it's a mind shift. Everyone, and that's why we're seeing so many people, they're just saying, I'm done with working. I'm just going to grow a vegetable garden and live in the woods. It's changing all of us. So I want to take advantage of that change, because also NCACH is changing, going from a Medicaid transformation to now whole person care, social determinants of health. Those are all impactful today, and something that we should be keeping our eye on and making our communities better because of that. So.
I see Penny speaks. I guess the other.
Just tell you something.
Please, Penny.
I use our federally funded clinic. Over 3 years ago, all federally funded clinics began whole health. That means my PCP works directly with a mental health advisor. I'm going to let it all out there. My child was in high crisis. He was going to attempt a school killing, my life and his own. For the last 5-6 years, it was really hard here. 2 months ago, I went into what a letdown situation where finally we had come to a level where I could fall apart. Yesterday was the first day I've been dressed in 2 months. I called my PCP 10 days ago, got me connected with him. When I spoke to a counselor who worked with my PCP, she said she'd contact my PCP to see if we would adjust my meds. We have whole health in Grant County, subsidized by our federal clinic. 2 years ago, the HCA sent a survey. In that survey, they listed all the things the federal clinic is doing and asked if we thought that would be a good idea for them to implement. Absolutely. I am telling you how functional that is. If I take a child in to see a doctor at federal clinic and we are going into a mental health crisis, immediately see a provider. A year ago, I decided to be a census worker. I was attacked by a dog. I went into the clinic to get care. I started telling them what was happening as they got ready to send me to x-ray. I burst into tears because of the PTSD. Before I went to x-ray, they had a counselor in for 45 minutes doing EDMR. We have it happening in Grant County. It is functional, it can be done. And the HCA already asked if that's what we want. Yeah. We need to go back to them and tell them, yes, This is what we want, and we need to funnel money to our clinics to start doing this because it works. Early intervention, putting money there. Washington State is a harm reduction state. We will always need harm reduction. There will always be the ones that slip through and the ones that the treatment models don't for. But we're putting the money at the wrong end. We are pulling people out of the river instead of spinning them forward. Whole health is the answer. And the federal government already does it.
Yeah, thanks for sharing that very personal experience, Penny, and and for what you're going through, but what you've gone through and being vulnerable here. And I think, as you're pointing out, there's pieces that are working clearly, and it makes a real difference in individuals' lives, and it's really great to hear that. I'm wondering if there's anything that jump out for the three panelists around how we scale what's working, other kind of bright spots that are already in place. This isn't an entire transition to something new. There's a lot of goodness that's already going on in each of the counties in this region. So, as we start to move to smaller groups, wondering if there's any last thoughts that might have been sparked by Penny, or kind of what's giving you hope as we think about kind of building on what's working in this regional community.
I think that the groundwork that we did over the last 5 years with Medicaid and shoring up the other entities in the communities helps us going forward. Now we need to build on that. The CHIs have their fingers on the organizations in their communities in a way that NCACH wants to do. We want to individually know who's out there, what are they doing, and how can we help. So that I do thank you, Penny, for all that you've done, and always being an advocate for mental health, and that's appreciated in our communities.
I would quickly add that I was really excited about the Oxford House going into Moses Lake. I got an RN that was flushing my board. Happened to be this Boston RN. They even cater to our persons that are in active addiction. It's there.
Michelle, do you have any kind of final thoughts or things that are kind of popping up for you?
I think just to touch back on the note that Molly mentioned, that it is a change. It is a change that is happening within ourselves. It is a change that is happening within our organizations and in our communities. And I think COVID, when we think about bright spots or pros and cons, COVID is terrible and horrendous, but has lent itself, just as all crises do, to forcing people to come up with solutions, a new focus. And so I think what I have appreciated is that I feel like together as a community, more people are coming to whole person health and to the notions that we really need to think about equity and we need to think about access. And so I think that is happening within each organization. And I think it's a big attitude change even within ourselves about how we think about our community and how we think about making sure that our community is healthy. Thank you.
Thank you. Rochelle?
No, I think Michelle just said it really well. Very, very well, just thinking about that whole person health. And Penny, thank you so much for sharing. I would love to connect with you on a sidebar more about what's happening in Grant County and whatnot, that maybe even I don't know, but just to hear that that is already in motion and it is incredibly encouraging. And I know that has been talks in the past, and I'm not sure how far, just in, I guess, my conversations, but I'm not sure if I had necessarily seen it as an organizational level. So to hear that that is taking place and in motion and in some cases is fantastic. And I hope that through conversations like this and the success shows in and of itself, that we continue to make that progress, because I think that will tell the story of why this change needs to happen and why it's effective. I mean, right at the end of the day, you're only as, your community, you want it to be strong and vibrant, right? Like you want the people of your community to be healthy. That's what makes your community. So I think this is fantastic. And again, love to hear what's already taking place and really encouraged what's to come and what we can do.
Well, thank you for that, Rochelle and Michelle and Molly, and want to actually, with Teresa's help here, invite you all into a little bit of a small group conversation with 3 or 4 folks. And hopefully you've heard there's a pretty significant shift on a number of fronts, and some of it's to be discovered. So with whoever you magically end up in your Zoom room with, I'm going to invite you all to first just kind of introduce each other and then move into kind of what feels like is most significant shift that you've heard, and what are you starting to hear that might be, implications for your organization, your community, and any ideas you have about what a successful bridge would look like, and any other questions that you come up with. So we'll check in let's say 20 minutes, so about 10 after. So you have about 20 minutes with some old or new friends, depending on who you end up with, and we'll talk to you on the other side. All right, we're going to get going in just a minute. If you all are coming back and you're able, it would be great to turn your camera on so we can see each other. So Caroline and Deb and Wendy, welcome. Marlene. It's kind of hard to get going after a 3-day break sometimes, but again, it's really nice to see all of you, and Elizabeth and I are looking forward to getting to know all of you better. So again, just wanted to create a little bit of open space. We're just big enough, but not so too big that we can kind of just share ideas. So even though we might speak over each other for a moment, we'll kind of figure that out. Would love to just hear from the different groups. We're not going to do a report out, but maybe just starting with the question, what, feels like kind of significant shifts that you're excited about, that you're kind of came up in your group as you were moving into this bridge year. Let's open it up to whoever would like to speak into that. We have about 15 minutes just to kind of hear some of your ideas.
Monty, I'll start it off. Miller Action Health Partners, I think I was in room 3. I was super excited. I think we all recognize, or we all shared, let's put it that way, we all shared the shift to recognizing community and the shift to trying to connect more strongly connect the clinical community linkages. And I found it fascinating because 2 of us were community partners with boots on the ground care coordination services, and both of us were expressing this disconnect with healthcare. And to hear some statewide partners or outside of the region partners express they have observed the same thing was kind of affirming to me as a community partner that, it wasn't just me that was feeling that, it was seen. So the shift to community and connecting with community was invaluable. And I think the other, that first part of the question is, what is the value that we bring? And in our room, the consensus was all of us, that community health worker piece of providing services, whether it's paid care coordinators in our health home program, or it's community health workers in the Care Connect, and it's lived experience folks. And I think about Joey's program with recovery coaches, and so recognizing the value of the lived experience and community health worker as we move forward is great.
Deb, thank you for kicking us off. That was really helpful. Yeah, I'd love others to just build on or add or bring in another perspective.
So this is Connie Mumching with Community Health Plan of Washington. I was in the group with Molly and Senator Paulette and also Shanae. So we talk about, the shift to more of the need for better coordinate across the system in light of, the regional crisis system redesign that's coming to play, and how that really need for us to pretty much improve across the system, not just the healthcare system, but also the social determinant of health partners. And we also talk about how, that telehealth is here to stay. So how do we address, telehealth in the rural community where broadband is still a significant issue? So we talk about some of those stuff. Yeah, so I don't know if other from the group would like to share further. Yeah.
Thanks, Connie. Just as a side note, Elizabeth is capturing your ideas on a Jamboard that if you all wanted to, you can click over there and follow along, and she'll pull it up here in a few as well.
Monty, I can go for our group. I was in a group with Penny, Alicia, and Teresa, and I'll lean on them to compliment what I'm saying if I missed anything. But I think Penny reminded us that it's good to remember that there are great things happening, and we need to celebrate those successes. So I thought I would start with that, because I think I do have a tendency to go straight to, okay, what are still the gaps? But that said, there still are gaps, and we spent some time talking about how that plays out for families in crisis, or we're trying to navigate lots of services and having a really hard time piecing them together. So there's a sense that there's a lack of identification of services. There's a lack of networking that could help people be more woven together as a system. And that sometimes there are duplicate efforts. And so the way that ends up hitting the ground for families is fragmentation and confusion. And that's something, I mean, we didn't say this explicitly, but I think all of us would be on the same page that we need to work on that this year together.
Thanks, Caroline. One of the other groups we have.
I can talk a little bit. My name is Veronica and I'm with Action Health Partners. So something that my group discussed is that we're excited this shift talking about whole person health and focusing more on the social determinants of health, as well as collaborative work. I work as a community resource specialist in the area, and I mentioned in my group that whenever I have conversations with community members, they always talk about all of the factors that are impacting their lack of access to a resource, or maybe their need for a specific resource. They will talk about how maybe their partner lost their job, so that has contributed to lack of income, which has contributed to their inability to pay for the rent and utilities. They talk about maybe weatherization things or healthcare. They have healthcare bills. So there's so many things that are impacting their household. So I think it's really important to realize, that a health issue has so many other issues attached to it, and that we need to be addressing all of it and not just focus on one specific part. And that also, brought about the conversation of collaborative work, of we're all doing community work so we can see needs in the community, but then realizing who can we reach out to, who's already providing those resources to meet that need, is there anybody who is providing that? And if there's not, how can we talk about it and make sure that there is something in the future? How do we, build off of that feedback? So whole person health and collaborative work are shifts that I'm really excited to start talking more about, starting conversations, and hopefully, making changes in this coming year.
Thank you so much, Veronica. Appreciate that.
I can share a little bit from what our room, it was talked about a lot of collaboration and partnerships coming together, and when everyone's at the table, there's a stake who can contribute and help develop concrete steps to move forward. But really having everyone at the table is crucial. And to the point of the last question, or what other questions or curiosities, how a great question came up is, how do you know when you have the right people at the table? Who's evaluating that table? Because if you don't have the right people at the table, then the decisions can't be moved forward because you don't have those decision makers at the table. So then who's then bringing those individuals, or how do you get them to the table to buy into this process and continue moving the process forward?
Great question. Thank you, Wendy. And maybe just even pivoting into thanks, seeing Penny in the chat and having people with lived experience at that table, and some of the ones Caroline's put in there. What else, as you all were thinking about this next year and how to really take advantage of this kind of new territory that you're starting to wade into, what other either questions or ideas around that we need to be attending to this coming year? Or anything else that felt like it was particularly significant that would be worth putting out there to the full group? Penny, did you have your hand up again?
Quickly about teaching us how to participate in legislation. You here with my video on?
Just slightly choppy.
Hold on. It won't let me stop video.
Maybe okay.
There we go. You talked really quickly about teaching those of us with lived experience, or just people on the ground, to participate in legislation. I think that's super important, because here I am writing a bill with Senator Warnick, and I can tell you how much I know about writing a bill. You ever heard Schoolhouse Rock? That's what I know. I testified yesterday before the Senate. It's my 4th time testifying before them. Yeah. Right before the meeting, I found the introduction of what I was supposed to say, because last time I didn't know how to do the introduction. That's a really important thing to do, because I never in my life thought that I'd be writing a bill, or that I could testify for something, or that I could make a change in this state at that kind of a level. I think that's a really, really important thing for you guys to focus on, because we can make a difference. And a closed mouth does not get fed, and you can't eat the elephant in one bite, but we can take a bite out of the elephant, and we parents on the ground can make those changes that will make this all work differently by changing the laws. I think that's a really important thing to focus on. Teach us how to do it, because Schoolhouse Rock doesn't teach you very much.
Mm-hmm. Thank you, Penny. It is funny how powerful Schoolhouse Rock is, and some of us are old enough to remember. And you're right. I mean, there's a lot more capacity to be built, and it's one of the kind of intriguing things, as you all are talking about collaboration, just the power of what a shared voice can do in terms of transforming systems that were not designed, or certainly aren't working, for everyone right now. And that seems like a really interesting and big opportunity. And I know through our experience at community initiatives, there's no more powerful combination of people who know the systems, that are responsible for the systems, working with people with lived experience that really have the greatest at stake for those systems working. So appreciate you bringing that to our attention, Penny. Any other, and Elizabeth, I may throw it to you in a minute here to see if you want to pull up the Jamboard. Any other kind of big ideas that came out of your, again, this is one of many, many conversations. This is the beginning of a whole new year and a whole new transition, but any other things that you want to put out to the full group?
Actually, this is a little bit of an expansion of what Penny said, but in our group, we talked about a lot of figuring out how we can support each other in our role in this work moving forward. So one of the questions I asked was if people understood how they can get involved after today's discussion, and it came to your point, right, that continuing to come together to figure that out is important. And what I would emphasize too is us together continuing to support each other to help all of us identify what our roles are and how we can and our organizations can help move this work forward. Because NCACH is trying again to embrace that distributed leadership, distributed decision-making process. So we don't want to get into the habit of telling you guys how to be involved. We want to get in the habit of working with you guys so that we can all support each other in identifying how each of us can be part of this process. And that's going to be important throughout the year.
Yeah. Thanks, John. And I noticed, Jim, you have your hand up.
Yeah, I really excited to hear this conversation. I was late into the call because I was meeting with schools, and hear them asking for a lot of ability to input and provide data, contribute data, so that the region can make better informed decisions about what schools are doing. But I love hearing that there's a shift towards getting more community input, because I think that really needs to drive healthcare and public health. And I think if we can begin collecting more data, there's data that's accessible on a state level that can help us drill down to county level, even zip code level, and tell us some about the health and wellness of our communities. And I think we need to use the additional resources that public health is going to have. I think we need to develop that ability to acquire secondary data sources. But I'd love to see NCACH support a process through which we can really get data from the ground, from communities, and learn more, know more about all the nooks and crannies in North Central Washington and the health priorities of the various communities in North Central Washington, and really have that drive and prioritize our pathway forward. So it's exciting to hear that that's a shift, or that's a priority for the ACH moving forward.
Yeah. Thanks for speaking into that, Jim. And I want to make sure I'm not missing. Did Deb Miller have her hand up too? Did I miss anybody?
Yeah, I do. And it actually goes along with what Dr. Wallace just said. So thank you for the intro, but talking about shared metrics, and moving a shared needle. I think, we've talked about that for years. I've been involved with the ACH since its inception in 2014, and we talk about it. But the issue as a community leader that I see is community doesn't collect the same data, right? Our grantors request us to report beans. Who did we serve? We aren't connected because we don't have the data sharing agreements. We don't know about the health outcomes. So what that we do community-based care coordination? How is it helping individuals, right? So I personally, and I'm guessing that there's other community partners, that I would be so inspired to know, so what? Action Health Partners has been serving X number of clients, and diabetes has improved, or hypertension, whatever the case may be. So how do we determine how we tie those together? My services that are beans and healthcare outcomes, how is it tied together to motivate us all and help us see how connected we really are?
Thank you. Well said. Joseph?
Yeah, I just wanted to share in our group, I was really talking with Molly about the importance of having somebody that's a trusted member of that certain population you're trying to work with. For instance, Molly works with the tribal community. I work with a lot of folks in the substance use disorder community, and we get tapped on the shoulder on a daily basis saying, this is what we need. How can you help us achieve this gap or fill this gap or achieve this goal? And it's important to have those people at the table, because now you're bringing the voice of that population to the table. And it's important that that person is a trusted member, because you're not going to get that engagement from that community if it's not somebody that that community trusts. And so I'm really excited for this shift.
Really great. Elizabeth, I don't know, I don't know if you want to pull up the Jamboard just so folks can kind of see some of their comments getting clustered in real time.
Sure, and thank you for adding their own sticky notes and helping me start to group these into some light themes. And feel free to keep adding and editing today and tomorrow and the rest of the week. We've got a great cluster up here where we're hearing a lot of excitement about this shift to whole person health and social determinants and getting community input. And then if we kind of go clockwise, we've got some great comments about people with lived experience and what you were just saying, Joey. I quickly tried to capture and add on that side of the screen. And then a lot of just acknowledgement that there's more work ahead in terms of collaborating across systems and really identifying those gaps and building those gaps, which leads over to our little data cluster that Deb and our colleague whose name I just was just sharing, and then continuing to think about how we can build capacity both through advocacy efforts that you were mentioning, Penny, but also I think John's broader support. How do we really build our collective capacity and really work together? So again, feel free to dump more ideas. This has been really fabulous and I've been trying to keep up, but you all have said some really powerful and exciting things.
Yeah. Thanks, Elizabeth. And yeah, I think just to double click on the fact that this is the beginning of, in many ways, not the beginning, but a conversation in this bridge year around how do we start to really translate these kind of ideas that feel like they're very much in harmony with one another into action, you know, over the course of this year, and to kind of really breathe meaning into kind of what it means to really bring community voice and be truly community driven. And, you know, some of the words that you use as we're kind of responding to people's need in a time of crisis to really getting a little bit further upstream in our community at some of the social determinants of health to helping folks. So it's an exciting start, and it seems like we have a lot of the right folks around this table. And I think to your point, Caroline and others, is how do we create a lot of other tables? How do we show up at other tables? What does it look like to make sure that we are in relationship with a lot of other groups? I mean, one of the things that Elizabeth and I noticed about a lot of great systems change work is that they understand how to tip systems, whether that's advocacy and some of the work that Penny's doing, but they also are developing these trust relationships. And so you all are already on that path. Lots of good things to build on. So maybe just thinking about looking ahead, I'm going to pass it over to you, Caroline, to kind of really talk about some of the more concrete ways that we might be moving forward together.
That sounds good. And I want to acknowledge that many of you are probably wondering, what are these shifts going to mean in the way that we fund partners in 2022? What are these shifts going to mean in the way that we convene partners in 2022? So there's some things we know, but I will be the first to say, and our whole team will admit, that we haven't figured it all out, right? Like, we wish we had all the answers in January so that you knew exactly what to expect this year, but we don't. The good news about that is that you actually will that means you have an opportunity to help us shape some of the things that are still ideas around funding, and you can help us decide how to make that work. There's some things that we do know that we wanted to share today, and then we'll open it up for questions, and we're really hoping you fire away with anything on your mind or anything that requires clarity. If we know, we'll answer it. If we don't, we'll work on it. So on this slide, the little color coding that you see is actually, it's a link back to the strategic goals that we shared earlier. And so for some of you that stepped into this meeting partway through or missed the beginning, Just know that we will have the recording, and we'll also send out the slide deck. And we were also thinking of working on a quick summary of some of the kind of concrete strategies that we are pursuing this year. So I'm going to invite Wendy and Joey to help me share some things that we do know. And Penny, we will definitely answer your question in doing that. We'll start with this first kind of bullet, which links back to our strategic goal around improving the behavioral health support network. So the funding, if you're wondering, like, what's the funding going to look like for that? It's going to be, there's not going to be an RFP process. So I will let Wendy and Joey speak more about what that's going to look like this year, so you know what to expect. Wendy, do you want to start off?
Sure. So many have already heard that we're having a behavioral health stakeholder meeting. For those of you who don't, we know that the destigmatization of behavioral health has prompted more individuals to seek care and overwhelming an already taxed system. With that, we see different organizations, from jails to law enforcement to primary care to community organizations, all implementing their own programs or changing their systems to try to meet the needs of their patients or clients or those who frequent the jail, like the people that they interact with. And so we need to come together and develop more efficient processes, so we're not bogged down in the minutia that we, the crisis care units, having to call 6 different clinics to find an opening for a patient. Those details that really bog us down, but instead focus on the attention and care that the individuals really need. So with the stakeholder meeting, it starts February 8th. If you're not familiar with it, you feel free to visit the NCACH website. All the dates and times are there. Just show up to the virtual meetings. Please register for the in-person, because we're providing some food for that. But the idea is that through this process, we're going to come together, identify the gaps and the successes, and just state the issues, like really look at the system, and then collectively develop solutions to address them and bring about the behavioral health system that we're really wanting in our region. And we're inviting, it's open for those with lived experience, family with lived experience. If you're in the system, work the system, everyone is really invited. And I'm telling you all of this because after that is collectively done, it's very participatory, hearing all the voices. Then collectively as a group, we will decide, the group, not we as ACH, the group will decide then how to distribute the funds to implement the action plans that come out of that. So as we create creative solutions and we have these to-do lists, a lot of times what holds these groups up is there's no funding then to implement that. Instead of the ACH coming and saying, okay, submit your RFP based on that action plan and then we'll decide who gets the funds. We're going to put the onus back onto the community to really prioritize what is it that the community wants implemented and how would you distribute the funds. So very participatory, no RFP, and truly meeting the needs that the community then has identified that will help move that efficiency and really help fill the gaps within the behavioral health system. So that's one example of this funding that we have for behavioral health that will be coming forth.
Yeah, thanks, Wendy. And there's a couple other examples that I wanted to talk about. And one of them is we started out with a jail recovery coach pilot, and it really turned into a community recovery coach pilot because we listened to what the community needed. And I really love, probably my favorite part of the role I get to do is I get to engage community and be there and have my boots on the ground to improve our behavioral health system. And there's the system that needs improved, and then there's improvement that needs to happen on a community level. And so to do that, we have to be in those community meetings and listen to them. Our community-based agencies tend to have less restrictions than some of the clinical organizations that work in the behavioral health system. And so we have really almost handpicked some of this funding process for the Recovery Coach Network. And the reason for that was because there's certain deliverables to make a recovery coach be able to do their job. They need to be able to, for instance, transport in their vehicle, and some certain organizations have restrictions on that. So we really have to dig deep and figure out, can this organization do and meet all these deliverables to make sure we're serving that population the best. And so we have our jail pilot, which is really a community pilot. Our partners for that are the Center for Alcohol and Drug Treatment, Treatment Court, the Department of Corrections, and most of our work and a lot of it comes right out of the Chelan County Jail. And we're working with those individuals. And one good thing that's happening, and it's really in the early stages, is we're advancing that work into an emergency department recovery coach pilot that will work with folks in and leaving the emergency department on substance use related illnesses or anything related to substance use disorder. And so those are just two examples of how we engage community to improve our behavioral health systems. So thank you.
Awesome. Thanks, Wendy and Joey. And if you don't mind chatting in your email addresses in the chat, if anyone has questions for Wendy or Joey, of course, you're welcome to ask them at the end of this meeting, but you can also reach out individually. For the next bullet, so they're color-coded pink and green, and this references back to our strategic goals around investing in skill building and capacity building around health equity or equity and increasing community resilience, and also investing in cross-sector collaborations and more integrated partnerships across the communities in our region. So this is an area where we wish we had like a participatory process all figured out, where local communities really came together to decide where and how to invest in equity work and integrated partnerships. We're not quite there yet, so we recognize we might have to release some interim funds just to keep the momentum going while we figure out those longer term processes. So our plan is to release an interim funding application to support work in the short term. And then again, this is an invitation to you all to know that as we build the more participatory process for these two strategic goals, you can help us co-design them and come up with what those should look like and what the priorities should be. So stay tuned for more on that. And then the last bullet has to do with the strategic goal to increase capacity building supports for partner organizations. So that might mean training or technical assistance. And Penny had a question about what we mean by in-kind training. Essentially, we as an NCACH are happy to bring in outside experts and trainers and cover the cost and provide that to you all free of charge. But we will need help figuring out what your training and technical assistance needs are, what the priorities are, because we can guess and bring in somebody, but if nobody's really interested, then it's a waste of everybody's time. So Wendy, I think you have a couple examples to share of things that are in the works. And then again, you can help us shape what comes down the pike.
Yeah, absolutely. We really do want these trainings shaped by the needs of the community. But a few things that have come out of conversations with my work with the WPCC and what others after talking with the partners that they've been working with. So WPCC has gone through some quality improvement workshops, but only those outpatient clinical providers. And we've heard that others would like that type of training. So we are bringing a quality improvement. It's more what we call learning activity. It's more of a hand holding, a longer term. I think it's 12 weeks. And it truly walks you through creating a quality improvement team within your organization. And the importance of that is really to know how to implement change within your organization, how to develop the metrics so that you know the change that you make, that you know it's successful or not as successful. And I know we have some on the call who can attest to when they finally implemented the metrics, they actually had the data to say that things were actually working versus not working, and it really helped them. Some other ones that have come out of some health equity trainings, distributive leadership trainings we've been doing with our board. We also are looking at, and Caroline, you may be able to speak to this more, some more network thinking leadership type workshops of how are we building networks together, how are we building the partnerships. It's not about the quantity of partnerships you have around this table, but the quality of them. And then finally, a human-centered design workshop is how are you using community voice to truly develop the solutions together versus a top-down type approach. So those are a few that are in the works. Some are further along in the planning than others, but by all means, if you have an idea that you feel like a training needs to be brought through, either it's maybe it's a 1-hour webinar or a half-day workshop, or something that's requires more intensive training, just drop us an email, let us know, and we'll look into it as we continue to explore, and we'll continue reaching out in these community convenings, asking for that information from you so that we develop what's important to you and fill those gaps and build that capacity.
I have a couple things I could add, but looking at the time, I would actually just love to open it up to make sure we address the questions that are on your mind right now. So why don't we just see if there are any questions from our partners that we can answer today? And if not, then I'll dig into a few other things. I know some of you are thinking things like, I wish I knew more about blah, 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 or what is XYZ going to look like? Don't be shy. Penny, I see you have your hand up.
Well, I put one in the chat, and that was about that in-kind. I wondered if you've considered in-kind training for persons with lived experience to become actually peer certified. They become part of the distributed leadership, and possibly that would go in that third category and make it possible for helping with the regional portfolio as they are on the ground. So you certify them in kind funding, they can help in the first and third part of your part vision, because they would be one leaders in the fleet, and through on the ground collecting that portfolio because they are doing it and in population and community.
And Penny, we would absolutely consider that. And I think our team will, why don't we just make a point of reaching out to you and get more of your thoughts and ideas on that and see how we could fold it into our plans.
I think a good thing to do would be to reach out to Joey. He has already done it. Like, he has an amazing program going on.
Well, the good thing is I know how to reach out to Joey.
It through you guys.
Joey,
he's done a beautiful job of it. You've already got, you know, back to that. What do we have right? He's already done it.
And he's at a click of a button for us. So yeah. Any other questions for the ACH team about what this bridge year means? Things that are not clear. Okay, keep thinking. It's very hard for me to believe that no one has burning questions. A couple things I'll just quickly mention is that one thing we didn't put on what to expect, the what to expect slide, is that the ACH is hiring right now for a community data director. I believe that's the title. And I wanted to bring this up since data came up a couple times on the call today. And I think this is another area where role clarity is going to be really important. So Dr. Wallace, to your point, where public health is really investing in building up a data infrastructure for our region. So how could the ACH complement that? And one thing that I can tell you is that the job description for our community data directors, we really want to focus that person on engaging community members and multi-sector partners from across our region to help build that data infrastructure. So like really ground up. Now, what exactly that will look like, we don't know, because it's going to be co-developed with community and with the Coalitions for Health Improvement as well, because they're very interested and are charging ahead with data questions. One last thing that I thought I would mention. Oh, I lost it. I thought there was one more thing that I could provide clarity on, and I lost it. So any other questions about what this, oh, I remember now. Partner convenings. So we used to convene work groups, and we're no longer going to do that in 2022, but we are going to have a monthly partner meeting for everyone and anyone who wants to join. And we'll make sure we make the purpose clear so that you can decide whether to opt in or opt out. And we'll get that information out soon, and it'll probably be on a regular cadence, so you can kind of just place a hold in your calendars. So stay tuned for that. Dr. Wallace, I see your hand up.
Yeah, Caroline, thank you. I just wanted to, I guess, ask the CHI to make requests to public health, go to public health, each of the LHJs throughout our region with a plan and with a request for how public health participate in this plan, because I know that each of our LHJs are very much interested in participating and using expanded resources that I think will come their way and collaborating with the, not just with the CHIs, but within NCACH as a whole. And so would love to see what the data director wants to do, but I certainly want to contribute some of public health's resources to supporting that role and ensuring that there's a synergistic result there.
And Dr. Wallace, I think that helps emphasize the theme that we really tried to talk about today, right? Is this isn't the NCACH doing things, it's how we as a region are coming together and using our collective expertise to do this work. So Caroline and I have talked to Luke a little bit, as well as Lori, about some of the data stuff that public health needs, and a lot of that is much better residing in public health than in our realm. So it's how do we use our shared experience and expertise to do that work, and that's really, you know, what we want to do over the course of this year is emphasize how we are coming together to support regional needs, whether it's how we come together to build data, how do we come together to make decisions, ensure all voices are heard, and then how do we bring that all together to identify the needs of our region and create action to do that work moving forward. We are nearing the end, so Monty and Elizabeth, I just wanted to, before any closing parting words, is there anything else you guys have that you wanted to bring up to the group to close this meeting out?
I didn't have anything. I think Elizabeth, did you have any?
No, it's been a wonderful morning. Thank you all for letting us join you, and we're excited about this journey.
Yeah. So then for all of you, I would encourage you, if you aren't on the listserv and this got forwarded to you, please get on the listserv, because we are going to be directing people that way. If you go to ncach.org, you can find all of our emails. And this is also an invite just to reach out to us. as well. This isn't, again, this is how we are going to move this as a region, and we need each other to join in that conversation. So please reach out to us if you have thoughts, if you have questions, if you have comments. Some we may be able to answer, some will just be clear and honest and say we have no clue. And that's really what it is. We're co-creating this together, and I heard that a few times throughout today, and that's the direction we need to go to create a healthier community. So Caroline dumped, if you're trying to get our emails, it's our first name at ncach.org. And then again, it's on the website in case you don't know how to spell our names. So I know sometimes that gets tricky. Other than that, thank you all for today. And thank you for being part of this. Happy New Year. And we're really looking forward to 2022 and working with all of you on this.